I think the really important thing with migraine is that it can be a symptom of other disorders, and sometimes it's hard to define whether someone is suffering from migraine or whether they're suffering from something else. So as an example, my lab currently does diagnostic tests for the known migraine genes, the familial hemiplegic migraine genes, but also for a number of overlapping symptoms that are not FHM and not due to FHM genes. And yet the people who present with, there's a disorder called CADASIL. It's a stroke-related disorder. It's the most common hereditary stroke disorder. And anyone who suffers from this will present with severe migraine. They'll also have white matter abnormalities in the brain as well, but that's a little bit harder to see when you're just seeing a patient. However, a diagnostic test can be used to define, am I looking at an FHM patient or am I looking at a CADASIL stroke patient who's actually got similar sorts of severe migraine overlapping symptoms? So I really think genetic information, and the more genomic information we get, the greater we'll be able to define the diagnosis of the patient, and that's really helpful for defining how you actually go ahead and treat them. Similarly, I think pharmacogenomics come into this as well. If we get not just the individual known monogenic genes, but perhaps profiles of genes that relate to treatment response, that will really help to target treatments more appropriately to the individual rather than just to the disorder. So that's the area that I think is important. Not to mention epigenetics. I think that's an area that we can all be working on by collaborating, developing enough power to determine what particular epigenetic markers, which particular genes change in relation to whether it's treatment response or whether it's in relation to development of migraine or types of migraine. So I think migraine is a really common disorder, highly disabling, and it's really not thought about very much if you actually look at the sort of funding that's available for research. And yet people who suffer from migraine are aware that we really do need to be doing more to target treatments and to come up with new treatments as well, potentially, and better diagnosis. So thank you for the opportunity.